This patient is a 5-year-old female that presents to the emergency department with a fever and abdominal pain. Her grandmother states that fever began yesterday afternoon and has got as high as 100.7. Her grandmother was able to manage the fever with Tylenol and Motrin. She also has complaints of lower abdominal pain that began last night. The abdominal pain is continuous in nature and doesn't seem to be aggravated with anything. It seems to get better with the use of the Motrin and does not appear to radiate anywhere. Upon arrival to the emergency department, the grandmother stated that she took Amelia to the restroom and upon her urinating, she noticed that the urine had a strong smell to it and was dark in color. Amelia has no past medical history. She has no surgical history. She does not take any medications. She does not have any allergies. She currently resides with her grandmother who has custody, and there is no family medical history of anything significant. Upon review of systems, the grandmother states that the fever began yesterday. She denies any chills or weaknesses or changes in appetite. The patient denies any ear pain, sore throat, chest pain, cough, shortness of breath. The patient denies any nausea or vomiting, but does state she has that lower abdominal pain that is continuous in nature, but again does not radiate. The patient denies any urgency or frequency or dysuria. The grandmother again states that the urine did have a strong odor and was dark in color. The patient denies any rashes and denies any back pain. Upon physical exam, the patient is cooperative. She's laying in the stretcher. She's happy. She's in no acute distress. She has no apparent rashes. Her pupils are equal and reactive and to light. Her tympanic membranes are gray, bilaterally gray, pearly gray, and intact with visible landmarks present. Her oral pharynx is pink and without exudate. Her heart rate is regular and has a regular rhythm. Her lung sounds are clear to auscultation. Her abdomen is symmetric. Bowel sounds are present in all 4 quadrants. There's mild tenderness upon palpation in the suprapubic area. But vital signs are as follows. Her temperature was 38 degrees Celsius. Her heart rate was 110. Her blood pressure is 90/56. Respirations is 24. And her weight is 18 kilograms. Labs that were ordered was a strep test, which was negative, flu, COVID, RSV, which was negative, abdominal x-ray, which showed no acute abnormalities, and a urinalysis, which showed a large amount of leukocytes as well as white blood cells. Her probable diagnosis is a urinary tract infection. This was ruled in due to the fever, the abdominal pain, and the large amount of leukocytes and white blood cells in the urine. Some differentials include appendicitis, strep throat, and constipation. The appendicitis was ruled in due to the abdominal pain and fever and ruled out upon physical exam, the patient not having the pain in the right or left lower quadrants. Strep throat was ruled in due to the abdominal pain and the fever, but ruled out due to the presence of a negative strep test, as well as upon physical exam, her pharynx was pink and without exudate. Constipation was ruled in due to the abdominal pain, but ruled out due to the abdominal X-ray showing no abnormalities. The plan for this patient is to treat with Motrin at 10 milligrams per kilogram, which is 180 milligrams, as well as Ceftonir at 14 milligrams per kilogram, equaling 252 milligrams PO once daily. ICD code is for UTI is N39, and the billing code is 99285.